I want to check the case. I think is this. Is this? Okay, just a minute. Okay. Is this case? It's a particular case. I think like you have this case. It's a Serpinginosus basilar tip aneurysm treated by endoluminal reconstruction. What is endoluminal reconstruction? It's a stent, but no flow diverter. It's overlapping stent. I place 7 Leo stents. Why? Because the wall of the basilar aneurysm is arteriosclerotic and is very complex. And the flow diverter don't work well because the diameter of the aneurysm in origin of the distal part is different. You have too much. Okay, I present this case and the midterm follow-up and control 1 year. It's a male of 53-year-old. I have a deterioration, cognitive deterioration progressive with troops of language, speak, and also have a Parino syndrome and hypoesthesia.
Go on, what's the patient? Did you know?
It's all right. Okay, and the test of neurocognitive test have a dementia, thalamic dementia, and the MR, magnetic resonance, you are partial thrombus aneurysm with hypersignal peripheral of the aneurysm is gliosis or desmyelinization. The angio, you are the Serpinginosus aneurysm in the proximal part, and in this part you have 2 branches. You are the superior cerebral artery and the posterior cerebral artery. This is the lateral view. And the test occlusion with balloon don't have the posterior communicant anastomosis. I decide to treat it, and in the first step, I place the microcatheter in the distal part of aneurysm to this point, and then develop the Leo stent, the distal to proximal, overlapping stent. Why don't use the flow diverter? Because the diameter on this part is impossible. This is different, and you are probably thrombosis. Why not to clip? I don't have a good neurosurgeon team to have this procedure. Okay, this is the road mapping, the catheter. This is the first Leo stent. Second, third, 4, and 5 Leo stent. This is the Leo stent. You are more quantity, more number of Leo here, and when I talk with the engineer, 3 Leo stent, I have the same effect of flow diverter because the cell is closed. This is the initial aneurysm. This is the Leo stent. After first procedure, and you are here the control. Pre-stenting, 1 month later, reduce the wall here, you are only this part. The branch, distal branch is still open. 2 months later, more progressive thrombosis of the aneurysm. And 6 months later, fantastic result. And the clinical symptom stay in the same situation, is not improve the patient, but it's not bad. Okay. This is the final scanner in 2010. 1 year later, have regrowth the aneurysm. This is the control 6 months. But 1 year later, regrowth, and you are this. You are one endolink here, another here, probably here, and here. In the later phase, you are the endolink, and you are the endolink from this and this. This is the reason we regrow the wall, the thrombus in the aneurysm. And how decide in this moment? Bypass, more flow, diversion of flow stent or stent, more overlapping, silk or paper line or flow diverter, proximal occlusion to invert the flow, holidays, why not? I decide to treat the aneurysm with more Leo stent. I place 2 more Leo stents. Total 7 Leo stents. But in the control angio, I have a small reduction of flow on the posterior cerebral artery. And few minutes later, the posterior cerebral artery is closed. I decide to balloon, to open this branch, and during manipulation, the wall of the artery is ruptured, bleeding. In this moment, I decide it's impossible to put to navigate with another stent or the flow diverter. Finally, I decide to close the artery with coiling. This is the final result. Stop bleeding, but don't have the collateral circulation in occipital lobe. After result, final result, you are ischemia. And finally, the patient dead 1 week later. This case is to check what sometimes is the difficult case and difficult decision to treat the patient. Look, now also don't have the ischemia in the posterior cerebral artery, also you have the ischemia and edema in thalamus and mesencephalus. Okay. Do you have any comment?
Does anybody have comments for Lewis?
What was the site of this aneurysm? I was not careful in the beginning. Is the basilar bifurcation aneurysm?
No.
Why not?
No.
It is partially thrombosed basilar bifurcation aneurysm with the channel inside it.
No.
You take a look on the angios.
It's thrombus, partial thrombus, but in the distal part of the basilar artery, no bifurcation. Why? Because just a minute, I think it's this.
But you see here is a take it back.
Look, you are here.
Take it. No, but take AP. Okay,
This is AP. This is AP.
Okay, yeah. What is this one? This is PCA.
PCA is this. And
this is PCA?
Yes, and this is superior cerebellar.
Yeah. And this is PCA also.
Yes.
So I was thinking that it is a channel inside the giant aneurysm here.
Yes, exactly. It's a channel. Look, you are more magnification. It's a channel.
Yeah.
Nice.
Yeah. Okay, it is, of course, whatever you are doing, so it is a very challenging case, and desperate cases need desperate treatment. This is how it goes here. But I think maybe there are no PCAMs in this case, so
don't have PCAM.
What we have introduced is the slow closing clip somewhere here. But I don't know, because for me this is a giant aneurysm in the basilar bifurcation, recanalized. But if can you show MRI once more?
I don't use the MRI. Do you want the MRI? The initial?
MRI. Yeah.
You have the channel here. It's complex case.
Yeah, of course, this is difficult in all the hands of the world.
I have.
Is Reza Behnam Yahram in audience?
Yes. Behan is here? No, I don't know. I have some case of basilar aneurysm complex is treated by inversion of the flow. If you want another session, I present one or two cases.
Maybe you could.
It's important to discuss.
In one session, you could tell what is the difference with all the different stents, because you are speaking like about food of them. Leo stent, flow diverter, pipeline. So it is very difficult to understand what are the differences, and so also to the laymen, what are those? Because what you see in the discussion groups, so the people are all the time speaking about different stents, and they love something or propose something. So maybe we should know. Pipeline is here in China is popular but extremely expensive. So it is more than 2,050 RMB. This is like more than $30,000 a piece of pipeline. So not regular people can afford it here.
Yes, it's the same price. The price in
So you push
Europe.
7 Leo stents. What is the price of them?
7,000 euros.
Okay, yeah, but this is much money. Also,
But
the
I
patients
don't.
are not paying. Yeah, yeah. This is different system. So in this,
Yes, yes, it's open. It's open cell. I prefer don't use the flow diverter stent in basilar territory or arteriosclerotic aneurysm. I prefer don't use because the radial force is not stiff, and with the flow, the stent going a growth endolink more. That's it's a point to discuss this complex animals.
Okay, maybe we can speak one time about with the stents and other difficult uses of stents. And
Where you want?
yeah, this is it John here? Is there some questions or?
Yeah, anybody have any more comments or questions in the audience? Very quiet. Oh, it's okay. Okay, you go ahead. Is someone have a comment? People are being shy today. You are.
This the slow closing clip is now. They are. I think they are making some progress in Shanghai, one company. So it will come on the market in some day.
I have one comment to Juha. One question. Juha, in how is your feeling or your experience with the medium-sized middle cerebral artery when you check with the angio 3D? More of the time you are involucrated the vessel in the wall of the aneurysm. But in my opinion, this point, when I discuss with the neurointerventionalist, I need to use the stent. I discuss sometimes, and probably it's not the vessel is involucrated in the wall. Probably it's close. But when you are the surgery, you're dissecting, and you are the neck. It's large, it's not, but you don't have many times the branch born in the wall of the aneurysm. What is your experience? How experience have you?
In proximal M1 aneurysms, the anterior temporal branch is coming from the base of the aneurysm. So if you want to do some endoscopy, so you have to push a stent there. And this might be expensive and unnecessary because the operation is so simple and the clip is so cheap. And what is the China practice here? So the rich people are taking stent and coils and the poor people are coming to surgery. Based on the background that the culture here is very much afraid of opening the head, and this is increased by the doctors and nurses. So it is somehow the society is afraid of the opening the head. But I think nowadays when you have bullet trains, you are flying around the world when it is again possible. So it is simple thing to open the head safely. So it should not be so bad. But one of the things also in China is that they are shaving the head. So the females lose their beautiful hair always. So this is also one indication in favor of endovascular surgery, of course. This is very difficult to change. Traditionally, it is very difficult to change. China is huge and very slow in change and some things very fast. So in 1 year they do changes more than in 5 years elsewhere, but then there are long tradition, they don't change. Like this shaving of the hair. This I think I shaved the hair last time 1982. So it is nearly 40 years ago. But now it is here difficult to introduce.
Okay,
Because they are afraid of infections and so on. So we can speak more about the next time. Maybe John has next webinar beginning. You have a lot of webinars now.
okay. I'm sorry, I lost my sound. I'm just going by what you're saying. So
Okay,
Victor,
okay.
Victor, could you
have
take
so
over,
many
please?
webinars.
Victor,
Okay,
take
thank
over,
you very much.
please.
Next Friday, same time.
Yeah.
Next Friday, same time.
I
Excuse
lost
me.
my audio. Take over, Victor.
Okay, okay. No, I think these cases are very interesting. Of course, the last case by Dr. Luis Lopez, hi, Dr. Lopez, I think is an unusual kind of aneurysm. And the resolution, the surgical resolution of that is not easy. As you said at the beginning, you need the team, equipment, some other kind of things to give resolution to this very complex aneurysm. So I think it's not easy by any kind.
Yes.
That kind of aneurysm, wherever it is treated in the world, would be extremely difficult, maybe not successful. So it is good to speak about the difficulties also, not only about the successful cases. This is very important.
Of course. Okay.
Okay,
Okay.
thank you
John.
very much, everybody. See you next week.
Thank you very
you.
much,
Thank you.
everybody.
Sorry about
bye-bye.
my